Ciao, what's up everybody? Alright, we're at Vinmec Medical International Hospital in Bintan District. We are going to take a look at the healthcare system in Vietnam. I constantly get comments that it's the worst, it's terrible, they're 20 years behind, all kinds of just crazy talk. So the time has come where Fat and Broke needs a full checkup. So we're getting all my blood work. We're getting everything checked. We're getting my boys checked, my swimmers, to see how many I got, because we're seriously considering having a baby. I'm getting all my heart blood work done, testosterone blood work done. I'm getting a full entire body checkup. And I came to Vinmec International Hospital. It is an absolutely phenomenal facility. It is pretty much state of the art as far as I'm concerned. It's all new. I think it's a few years old, maybe 3 years old. It's got an excellent staff. My doctor was Vietnamese, but he fully spoke fluent English, and he even studied abroad. He knew a lot about what he was talking about. Now, let's segue into this real quick, and then we'll segue back into the actual healthcare system. It is important that if you are going to use the healthcare system here, you're going to want to get some insurance. So, insurance is not crazy here either. It's actually very, very affordable. It's you wouldn't believe it, but like for the most top tier double platinum, triple platinum, bypass surgery, crazy insurance, it's like $1,400 for a year. So it's very affordable, and they sell them in these different packages essentially. So like I was talking about, I have like the platinum, the highest one. I think mine was $1,000 a year or somewhere around there. And it depends on your age, of course. If you're over 60, you're going to be paying more for insurance. That's anywhere. But I still think it's pretty reasonable, even over 60, to get like the high tier package. You know, it's a much more affordable healthcare system here, and it's actually pretty efficient. I was able to just rock right in with my insurance card, checked into reception. From the time I went to reception to saw the doctor for consultation, it was 8 minutes. I kid you not. With me filling out paperwork and all that stuff. So if you schedule your appointment ahead of time like I did, I scheduled it a day ago. You know, I was able to get in here, get in quick, get what I needed. For my test that I need done, since we're checking testosterone, I'm going to come back tomorrow in the morning. It's best to check your testosterone early in the morning. So right when you wake up. So that's what we're going to do. I'm going to come back here tomorrow. They're going to take a lot of blood from me, and then they're going to test it, and we're going to see where I'm at. And if I'm low on testosterone, then guess what? Your boy's going to be taking some testosterone. We're going to get jacked. We're going to get juiced. And we're going to check out my heart and my heart health, and, you know, make sure all the drinking and smoking and shit hasn't caught up and done some crazy damage. And also because, as you know, my pops died last year from heart failure. You know, good hearts don't run on my dad's side of the family, so we've got to get this stuff checked out just to be precautionary and to be safe. This will be a multiple part video, but yeah, I'll try to get you a few insurance companies as well, and you get to see there's a mass spectrum of the affordability of the insurance here, and there's so many different companies that offer it. So like it's super easy to get health insurance here. It's not that costly, it's easily done, and they sell packages in different tiers. So like if you're a young guy and you're going to be here like under 30, you can just get like a $200 a year package that just covers the basics. You know, it doesn't like go into any like great long stays at the hospital and stuff like that, but if you break your arm, it'll cover that. Which, by the way, even if you do break your arm without insurance, that's still like $100. It's not nearly what it costs. Like the way that they do insurance here is you pay first, and then they kick it back to the insurance company to check to see if it was viable. Like, say if all the tests I get done today and everything's perfect and on the level and there's no treatment needed, then I'll have to pay a portion of the, I think they had me put down about $120. So I'll have to pay a portion of that 120 back. Now, if any of that stuff is, if something's wrong with me in any of the tests that we're doing, then the insurance will cover the whole thing. And I can tell you, you know, everybody's highly educated at this Vinmec International Hospital. Your doctor's going to speak English. You're going to be able to say what you need to say. He was very interested in what I had to say, and he understood exactly what I wanted to do, and he agreed with what I want to do testing-wise, you know. We're in the beautiful, beautiful Vinhome Central Park, by the way. I will be doing a video on the livability in Central Park. It offers such a different experience to the Golden River, which I am going to be telling you, rent at both, and I'm going to give you the various reasons. I've already done videos like that, but there's great interest in the Golden River video I did, so I kind of want to keep that momentum going and then explain a little bit about Central Park and why people choose to live here, and then the rental prices in Central Park, and then also getting you agents to help you find a unit here at an affordable price and work with whatever your visa situation is. So yeah, as far as I'm concerned, I think Vietnam has absolutely an amazing healthcare system. It depends on where you go. I've already gone to a dermatology hospital as well, and another place to have a pretty much a physical, like, I don't know, 5 months ago, and that was great too. That was all Vietnamese. They didn't know any English, and I was able to get through fine, 100% on my own. So, this isn't what people like to paint it out as. Like, they've caught up greatly with other countries' healthcare system, especially in Southeast Asia. I'm not worried. If Winnie's gonna have a baby, we're gonna have it here. They've got great hospitals like Vinmec. If you do need stuff, come to Vinmec. If you're gonna pay out of pocket, it's not gonna be that crazy. If you can get health insurance, go ahead and do that. They'll pretty much give health insurance to whatever kind of visa you have, even the 30-day one. So I'll try to gather a few insurance companies for you and put the information on there. But it's relatively easy to find this stuff, especially when your boots on the ground here. Everything's done through Zalo, just like we talked about with the Golden River apartment renting. So yeah, that is my update. I will keep you updated on my journey. Tomorrow I come back and do all the blood work. Once we get the blood work back, we get the results, we'll pop up another video and we'll talk about all that stuff. So I'm gonna keep you informed. As always, I'm trying to help out people that are wanting to travel to other countries and see what it's like there if you are gonna be there. So thank you for watching. Stay frosty. If you like this video, subscribe to the channel, hit that like button and leave a comment. That would be very, very awesome of you. Peace out. All right, we're back with part 2. As you can see, the homie's testosterone was low. So yes, my testosterone levels were that of a 65-year-old man. So we are on TRT. I've been on TRT for about 5 days now. The whole process from start to finish, my insurance did not cover it. I will list some insurance companies for you, but if you're going to be doing TRT, the insurance does not cover it. Even if it's below the level, which mine was, they still say it was for hormones, and they kind of put that in like a cosmetic category for my insurance. I don't know if all insurances do that here, but it's typical kind of insurance company stuff. So it was 5.5 million for the blood work. My heart was fine. The testosterone was low. Everything else is fine that we had checked on me. So I'm pretty much healthy other than that. I just needed to be on TRT. So I am on the gel. I know you're supposed to have the injections. Everybody bangs on about the injections. I'm currently looking for a place to get injections in Ho Chi Minh City. So far I haven't really found any. A lot of the hospitals I've talked to, they only do the gel. The gel does work. I can tell you after my 5 days of using it, I've definitely had like a 10% boost in speed and performance. I'm definitely hitting the gym a little bit harder. You can feel it kick in after about a half hour. I'm definitely noticeably seeing changes. I'm happier as well. It's definitely all for the good. It was something that I really needed. So if you're a guy that's over 35 and you're feeling a little lazy and lethargic and belly fat isn't going away as fast as it should, and you're just feeling a little off, you might want to get your testosterone checked. I'm very glad that I did. I don't know how long I'll be on this stuff for, probably for a good amount of time, and I'm glad that I did it. So before we get into the rest of it, like I said, it was 5.5 million for everything from Vinmec. If you want to go and do it yourself, you just go to general consultation, book an appointment, and they will give you blood work and they will test it. If it's low, then they will do the same thing, give you a prescription of the androgel. They give you 30 days at a time. You apply it to your shoulders, let it dry, fully absorbs into your body in about 15-20 minutes, and you can go do whatever you want. So it's not going to like come off. It absorbs in, like if you've ever taken liquid acid or anything like that. So before we get into, my experience with Vietnamese doctors has been very good, but all I've done is gone to that, and then I've gone to a dermatologist for a skin rash I had, and I went to the actual dermatology, which is an all Vietnamese hospital, not international like Vinmec is, and it was phenomenal. Again, I didn't have anybody with me. I just went there by myself, and I freestyled through it and figured it out and saw a doctor, and they gave me what I needed to get rid of the rash I had, and Bob's your uncle. So it really worked out very well for me. Now, to the counterpoint of this, I have a good friend here, and he's had way different experiences here. He's lived here a little longer than I have. So, both of my kids were misdiagnosed at 2 hospitals, Family Medical and FV, which led them to have bronchial pneumonia and required a week in the hospital each, one right after another. When I broke my leg, the doctor, Family Medical, wrapped my wound shut and it became infected. He also put the cast down wrong, and when I went back to have it removed, they didn't have the saw available to cut it off, so I had to go to FV to get it removed. After they saw the wound, they were about to cut the skin off my foot without any anesthesia. No effing joke. After my wife gave birth, her C-section had an infection. The doctor said it was no big deal. She went back the next day, Han Fuk, and he said maybe you do have an infection after all. And he's got more stuff to go off of that. They said they finally found a great pediatricians at Raffles Hospital. But yeah, I would definitely, over my experiences, I would very much so recommend VinMec in Central. It's great. It's right there in Landmark Central. So if you do need a good hospital, it has good staff, good new equipment. My experience was very good there. I'm very happy to be on TRT. Let's get yoked, baby. Let's get jacked. I've had a great experience with the medical system here. As I said, this stuff's really easy to put on. It comes in a packet. Cut the packet, do one shoulder, do another shoulder. You're going to want to take a shower first ahead of time. And it does the job. It doesn't wear off till like 2 or 3 a.m. I go to sleep by like midnight usually, so that's not really too big of a deal to me. I wake up and I take it again, and it lasts all day. That is the big difference between this and injectables. No, I'm not on an estrogen blocker. We are going to redo my blood work in 30 days and see where it's at. I'm going to try to find an injectable place in between that and also get on an estrogen blocker to really, get yoked and let's get after it. So overall, my experience has been good. To any guy out there, I do recommend that you get your testosterone checked past the age of 35. Even if you're feeling okay, it's not that hard to get the blood work done. I think TRT should be being used way more and talked about way more. So let's get it, baby. So yeah, that's been my experience so far with everything. Would I still get some crazy surgery here if I had to? Probably. I don't know that I would fly back to get, another surgery. I'd have to really think about it. My one really good friend, he's had some bad experiences here, but I don't know. Like if I had to get open heart surgery, I don't know. Would I get it here? Probably, because I wouldn't really have a choice, and I probably wouldn't be too worried about it, but YOLO. I know. There's better places with healthcare. Thailand has a great healthcare system. So that is the video. I hope this was helpful to some of you guys. I'll try to list some insurance companies for you in the description. I'll put VinMec's address in there. If you want to get on the TRT, just go in the general consultation. You don't need to ask for any special doctor or anything like that. Like I said, it's going to cost you about $5.5 million if they do put it on you with a 30-day use of the gel. All right, guys, stay frosty. Thanks for watching. See you on the next one. Peace out.